Hi, I'm Yvette LeFebvre. I am the Chief of Post-Acute Care, DME, and Sleep Services at eviCore Healthcare. I'm board certified in emergency medicine and practiced in both emergency department and urgent care settings before I decided to transition to the non-clinical side of medicine. When I first left clinical practice, I worked for a company that provided utilization management and Medicare compliance services to hospitals and healthcare systems. I then worked as a Medicare Advantage medical director on the payer side. While working on those two sides of the world, I realized that I could positively impact healthcare for a much larger number of patients doing this type of work than I was able to impact during my clinical career. I came to eviCore in 2016. I actually followed my boss from my previous job shortly after he came to eviCore to lead the medical director team for what was then a new program at eviCore, our post-acute care program. He was someone who truly believed that good medical care is cost-effective medical care. And so the more I investigated eviCore's philosophy, I found that it also aligned with that ideal. In the post-acute care program, we have weekly case conferences attended by medical directors, nurses, and social workers. During my first year at eviCore, during one of those case conferences, we were discussing a member who had a history of multi-drug resistant urinary tract infections. The member was receiving antibiotic treatment as well as skilled therapy in a skilled nursing facility. As we were discussing that member's treatment, we noticed that the member's most recent urine culture results showed that the member's infection was actually resistant to the antibiotic with which the member was being treated. So after our discussion, our eviCore nurse called over and spoke with the nurse at the skilled nursing facility and alerted them to this information. The provider was then able to quickly adjust the member's antibiotic regimen and get them onto an antibiotic that would actually treat their infection. So while that issue likely would have been picked up by the attending physician when he or she rounded at the skilled nursing facility, that might have taken a couple more days. And by having our extra eyes on the case, we were able to assist the provider with getting the member onto the correct treatment sooner than later.